to be honest, this really now adds a new tool to my particular strategy for helping my patients who have osteoarthritis, who are medium and large size dogs.
We are here with Dr. Robin Downing out of Windsor, Colorado. She is the hospital director and founding member of the Downing Center for Animal Pain Management in Northern Colorado. She is a graduate of the University of Illinois College of Veterinary Medicine, and she has done so much for pain management and research in animals. Just two quick things about how awesome this lady is. She was the third veterinarian in the world to credential as a diplomat in the American Academy of Pain Management. And she was a founder of the International Veterinary Academy of Pain Management and served as the organization's second president. So thank you, Dr. Downing, for taking some time to chat with us this morning.
Well, I really appreciate the opportunity to speak with you as always. So thanks for the invitation.
So can you help viewers just have an understanding of what you do day in and day out?
So in addition to general primary care practice, where I treat and manage patients from womb to tomb, from cradle to grave, I have the Downing Center for Animal Pain Management, which was, as you stated, Northern Colorado's first and still only comprehensive pain prevention and management practice for pets. So I do a lot of just assessment of animals, cats and dogs, who deal with chronic pain issues. I see my own patients from my primary care practice who then transition over to the pain management practice, but I see other practices patients as well, because clients and my colleagues will recognize that they're dealing with an animal who's facing some challenges, life limitations from chronic pain, and it gives me an opportunity to assess them and then intervene on their behalf from a multimodal pain management perspective. We now understand that chronic pain is best managed from a multimodal perspective, which means that we come to the pain from different perspectives, from different approaches. So we have pharmacology, and we have nutraceuticals. Nutraceuticals are nutritional supplements that act like drugs, but they're not really drugs. We have environmental enrichments and environmental modifications. It's one of those environmental modifications involved in this really groundbreaking study that was done at the University of Pennsylvania, utilizing the orthopedic beds from the Big Barker Company.
So let's talk about the study, because what we really are here to learn about is your feedback and your opinion and your thoughts after reviewing the study. So after taking a look at what they did and the results that they got, what stood out to you about the study, or what were the most important results to you from the study?
Well, probably the first thing that stood out to me is that I found this to be a really innovative study. I am unaware of any other formal research group, particularly affiliated with an academic institution like the University of Pennsylvania, that's undertaken any kind of study looking at sleeping surfaces, for instance, to benefit dogs with diagnoses of osteoarthritis. So the innovation, the insight to really pursue that really got my attention. The subpilot study, so the population of study animals was fairly small, and that is typical of pilot studies. Pilot studies are designed to give us guidance about what do we need to focus more attention on, what do we need to focus more research on. And I think the next thing that really stood out to me is the value of this particular pilot study as a way to really open the door and understand that we do need more data from a wider selection of dogs facing chronic pain issues. Why might I say that? Well, because of the third thing that stood out to me with this study, which was recognizing that in this group, in the pilot study, 3/4 of the dogs involved demonstrated a statistically significant difference in their comfort levels as measured by their restlessness at night. 75% is a really big percent of these dogs who actually demonstrated benefit that was statistically significant when it was analyzed by accepted research protocols. So what does that tell us? Well, it tells us that this is not a panacea. This is not like a end-all be-all. This is a piece in a multimodal pain management strategy, a cog in a wheel, if you will. But what really grabbed me is that one of the difficulties that we face when we're dealing with dogs that have the chronic pain of osteoarthritis is that they have a real difficulty getting good rest. They have a very difficult time sleeping in one position for any period of time. And that's something that I speak about with my clients all the time. And this is something that my clients mention to me, that they hear their dogs getting up in the middle of the night. They get up, they move around, then they lay down. They get up, they move around, they lay down. And that they, the humans, really perceive that their dogs are not having peaceful, restful sleep at night. And so of all of the data points that we could think about in a study like this, the one that really stood out is that a great majority of dogs had a statistically significant improvement in their ability to sleep at night. It wasn't 100%, but it was a significant enough percent that it really does open the door, that it lets us know we need more data, we need more research, and we need to ask the question, are there then more dogs out there that really could benefit from this kind of addition to their environment?
So I think you've already answered this question, but it was a pilot study and it was a proof of concept study. Do you think the results that they got from the study impact or warrant further study in this area, as using, in particular, the big Barker orthopedic beds as a home modification device for dogs with osteoarthritis?
So I've alluded to the fact that I really do think this pilot study opens the door for additional investigation. This particular tool, this orthopedic bed that has been created by the Big Barker company, is the tool that was investigated. And I believe that the results from this pilot study warrant really two things. One would be additional data generation among dogs who have diagnosis of osteoarthritis using this particular tool. Mm-hmm. But in addition, it would be interesting to really take a look at then in the future comparisons with other tools. For instance, is their design, as it's clearly demonstrated in this study, in this pilot study, that the current design that they have created has made a positive impact in a majority of dogs to improve sleep in those dogs in the study. Mm-hmm. So it would be interesting to ask the question, if we compare this design with design modification, are there ways to tweak what they have created to make it even better?
And so as far as you as a private practitioner, right, you and your clients, many of which are probably big dogs with osteoarthritis, how are you impacted as a practitioner in the way you think about dog beds as part of management for osteoarthritis?
To be honest, this really now adds a new tool to my particular strategy for helping my patients who have osteoarthritis, who are medium and large size dogs. I've talked with clients for years about environmental modification involving things like keeping them off of slick surfaces, protecting these dogs from going up and down stairs in an unsupervised way, making certain that we raise their food and water dishes to about elbow height so that their back is in a neutral position when they eat and drink. These are pretty simple, straightforward environmental modifications that I've talked about with hundreds and hundreds of clients over the years. I've not spent a lot of time talking with them about the actual sleeping surfaces that their dogs experience. I've talked with them about nighttime restlessness, and we've talked about managing pain at night. But this really gives a new dimension to the conversations I'll be able to have with my clients, where I can make an evidence-based recommendation to say, I think it's time for us to modify not just how your dog experiences pain in the night, but how your dog experiences night, how we can maybe make that nighttime experience more pleasant for them, allowing them to get the deep and restful sleep they really need and deserve.
Well, thank you so much, Dr. Downing. We certainly appreciate you weighing in on the results of this new study.
It's really my pleasure, and I'm grateful that people who are far smarter than I am can think through looking at and asking questions like, how can we help dogs sleep better at night? Do we have a tool that can make that happen? I really appreciate that kind of insight, and I really appreciate now having a new direction that I can take, a new dimension that I can use in my discussions with my clients.